Hello, and thank you for participating in the Adult Protective Services, also known as APS, Basic Skills Intro to APS, Webinar 1 or 4. My name is Denise Leak, and I work for the Division of Aging and Adult Services. I am the Program Services Consultant for the state of North Carolina, and I travel across North Carolina providing trainings and presentations. Please have a copy of the following available to review during this webinar: the Administration of Community Living Voluntary Consensus Guidelines located at acl.gov, the True-False Question Test, and the DSS 5027. If you do not have these available at this time, please pause this webinar to secure these documents, which we will reference in the presentation. As a helping professional, your goal is to help vulnerable adults. It is important to always remember this is an underlying foundation when performing your job duties. This introduction of both ethics and APS practice in general will help you learn how to protect the rights of vulnerable adults in North Carolina as you administer adult protective services required by the North Carolina Statute, Administrative Code, and Policy. In this webinar, training participants will gain an understanding of the following: ethics as they apply to the APS practice, APS basic principles and tenets, APS general statute, what is adult protective services, and APS definitions. Professional ethics are at the core of social work practice. Ethics can be defined as good or right conduct. Ethics reference a branch of philosophy dealing with the value of human conduct as is useful in assessing the rightness and of decisions and the fairness of the decision-making process. This means doing the right thing, being honest, and differentiating between right and wrong. As social workers, you promote social justice and social change on behalf of the vulnerable adults. Also, as social workers, your primary responsibility is to promote the well-being of vulnerable adults. The Administrative for Community Living, or ACL for short, is an organization you're going to start hearing more and more about. ACL has recommendations that Department of Social Services should do. Many departments of social services have already adopted a lot of the recommendations. ACL is a comprehensive system that supports older adults and adults with disabilities in having the right to choose where and with whom to reside, and in having the right to fully participate in their own communications without threat of abuse, neglect, or exploitation. The goal of ACL was to develop a core set of principles and common expectations of consistency in APS practice across the country. ACL wanted to make sure that adults are afforded similar protections and services no matter what state they lived in, as there is no federal home for APS. It is recommended that APS systems establish and adopt a set of ethical principles and codify them in their policy and program manuals. It is recommended that APS system require all employees to sign a code of ethics that includes, at a minimum, key concepts such as least restrictive alternative, person-centered service, trauma-informed approach, and support decision-making. The system's code of ethics would be signed at the onset of employment with APS. In addition, it is recommended that training on ethics be covered under pre-service training and ongoing staff education. Key concepts in the ethical foundation for APS practice include, but are not limited to, least restrictive alternative. Least restrictive alternative means a setting, a program, or a course of action that puts a few limits as possible on a person's rights and individual freedoms while at the same time meeting the person's care and support needs. Person-centered service. Person-centered service refers to an orientation to the delivery of services that considered an adult's needs, goals, cultural traditions, family situations, and values. Services and supports are delivered from the perspective of the individual receiving the care and, when appropriate, his or her family. Trauma-informed approach. A trauma-informed approach seeks to do the following: realize the widespread impact of trauma and understand potential paths for recovery. Recognize the signs and symptoms of trauma in clients, families, staff, and others involved in the system. Recognize by fully integrating knowledge about trauma into policies, procedures, and practices. Actively resist re-traumatization. North Carolina Department of Social Services are already practicing least restrictive and person-centered approaches, so these recommendations in large part upon practices that have already been adopted. Let's look now at APS guiding values. Every action taken by APS must balance the duty to protect with the right to self-determination. In addition, vulnerable adults who are victims of abuse, exploitation, or neglect should be treated with honesty, caring, and respect. APS social workers are statutorily obligated to assist or offer assistance to disabled adults who are abused, neglected, or exploited that are in need of protective services. However, these two critical guiding values must lay in the foundation of the practice. We defined ethics earlier, but why do we need ethics? How do ethics guide us professionally? We need ethics because it defines who a person is, helps us know right from wrong, and gives us structure. Ethics guides us because it is a set of rules. Displayed are some of the ethic concepts in APS. As we move forward, you will notice that ethics and tenets are interwoven. Both ethics and tenets create the foundation of social work practice. Displayed now are 8 APS principal tenets that are used in the provision of APS social work provision. At times you may feel conflicted over some of these principles. You will need to be aware of this, as this awareness will help you to control your feelings as you provide social work services. Now we're going to look at ethical concepts that go along with APS principles. Autonomy through self-determination is the number one and most important principal tenet. This is the right of individuals to make choices as long as they have decision-making capacity and cause no harm to others. This includes decisions that you may not like. Here is an example of how the tenet of self-determination might challenge your opinions as it relates to vulnerable adults. Think of a time in your adult life when you made a bad decision that yielded poor outcomes. Most of us can identify with the sinking feeling that comes after spending too much money shopping, whether at the mall or at the grocery store. As helping professionals, it is often our desire for those to serve to have the highest quality life possible. We want to protect them from what sinking feeling or other more serious negative outcomes. While the intention to protect is a good intention, we have to remember that the adult is entitled to make the bad decision if it is not what we consider to be a good decision or the decision we would have made. Adults can make bad choices as long as they understand their choice and the consequences of what could happen from that choice. Displayed is the second APS principal tenet, accountability, trust with honesty, caring, and respect. You may have heard the Golden Rule. The Golden Rule is the principle of treating others as you want to be treated. It is a maximum that is found in many religions and cultures. It can be considered an ethic in some religions, although different religions treat it differently. Sometimes it's not always golden. An example of this is that how you like to be treated may not be the same as how someone else wants to be treated. As a social worker, you want to strive for honesty, respect, accountability, and responsibility. You cannot control the adult's responses, but you can control yours. It is not personal, and it should never be made personal. You must be able to remove your own emotions. You will want to remember that the APS process is intrusive and maintain an awareness of the anxiety or fears the adult may have about the process. The adult may believe that the goal of APS is to place them in a facility. This is the third APS principal tenet, utilizing least restrictive approaches. This can be a very difficult task. Least restrictive looks different to everybody. What we feel is least restrictive may not be what the adult feels is least restrictive. You want to look at all areas and possibilities for this adult. You must be able to remove your own feelings and your own thoughts and think about what is best for this adult. You want to look at all your options and weigh out all possibilities. You will often have to think outside the box. An example of an approach that is not least restrictive is placing all clients in need of protection in the facility. Placement outside of the home is one of the most restrictive options. Other options to address the adult's needs in the home setting should be explored if lesser restrictive options such as in-home aid care could address the safety needs. Displayed is the fourth APS principal tenet, fidelity with the highest priority given to family and other normal support systems. Family looks different to everybody. We may consider blood family our family. Some people do not. Some people consider best friends, clergy, neighbors, or other kinfolks. Relationship their family. We all rely on support from others in our everyday lives. It is rare that we make any decisions without input from family, loved ones, friends, or co-workers. Neighbors can be one of the greatest resources available to vulnerable adults. It is imperative that social workers identify who makes up the adult support system, as these connections could prove to be a great natural support for the adult. Displayed is our fifth APS principal tenet, inadequate or inappropriate interventions. As a social worker, you should know your local resources in your community and who to contact for your assistance. You never would offer cancer treatment to someone who didn't have cancer. You would not offer mental health treatment for someone without mental health concerns. This is an example of inappropriate interventions. You want to allow the adults you serve to have the say in their interventions when possible. You will need to be creative and think outside that box. Displayed is our sixth APS principal tenet, shared responsibility. DSS does not serve citizens all alone. DSS often takes the lead role. However, in order for efforts to be successful, there must be community partnership formed. It is encouraged to meet with your community partners regularly and provide information and education about the APS process, including what APS social workers can do, must do, and cannot do. There is a term called aging in place. This term is used to describe when an adult wants to remain in the current living situation, usually in their home, as they age. As long as the adult is safe and it is possible, they should be able to do so. Allowing the adult to age in place could help the adult improve their quality of life and physical health. Displayed is our seventh APS principal tenet. Justice emphasizes an APS is always only needed protective services rather than investigating of incident. APS social workers are not investigating. APS social workers are evaluating and determining if maltreatment happened and what services can stop that maltreatment. Unlike criminal investigations, where the focus is on the perpetrator, Adult Protective Services is geared at answering the questions: is the adult disabled, maltreated, and in need of protective services? This is another reason why partnership is important, as law enforcement or the district attorney may have a role in investigating the criminal side, and these referrals are important. Displayed is our eighth and last APS principal tenet, privacy confidentiality. APS social workers often interview collateral contacts. Collateral contacts are those people connected with the adult who can give insight to health, welfare, and safety needs. It is important to remember that APS social workers can ask questions of these collaterals but cannot provide information to the collaterals about the adult's case or status. Confidentiality is an absolute pillar a social worker and is critical to appropriate protection. APS social workers have a duty to protect the privacy of an adult. Reporters are not privy to what the adult says just because they made the report. Reporters can get notices of whether the report was accepted or not. Reporters may also be collateral to provide more information during the evaluation. Reporters can get a notice at the end of the evaluation, but only if they request it. What is Adult Protective Services? Adult Protective Services are services provided to ensure the safety and well-being of adults with disabilities who are in need of protective services due to maltreatment, including abuse, neglect, or exploitation. This includes self-neglect, when an adult is unable to care for themselves or protect themselves and there is no one to assist them. Adult maltreatment is often underreported. As we have discussed ethics and tenets, you have already learned a lot about the APS process. This definition varies from state to state. In North Carolina, for the purpose of APS, a disabled adult is one who has an impairment that is impacting their functionality. APS social workers and supervisors are encouraged to broadly interpret this definition, and if in doubt on whether a person is disabled or not, err on the side of caution. At this time, pull out your true-false question quiz that you printed off the website at the onset of the training. You will press pause to begin the quiz. You are encouraged to place the section of the manual that you locate your responses in beside your answer. This practice of finding answers in the manual will help your skill when you return to your casework. When you have completed the quiz, continue this webinar to hear the answers. Press pause now. Question number 1. There are 5 areas that must be completed on the APS report. True. And it can be found in North Carolina General Statute 108A, 102, Manual 3-1. Question number 2. You must send an initial notice to law enforcement and district attorney upon finding evidence that a person has been abused, neglected, or exploited. True. And it can be found in North Carolina General Statute 108A, 109, Manual 3-2. Question 3. Anyone who makes a report does not have immunity. The answer is false, and it can be found in North Carolina General Statute 108A, 102, Manual 3-2. Shall be immune. Question 4. The Department of Social Services must accept anonymous reports. This is true in state policy, and it can be found at Manual 3-2. Question 5. Department of Social Services cannot orally receive an APS report. False, and it can be found at North Carolina General Statute 108A, 102, Manual 2-1. Department of Social Services can. Question 6. A report should always be considered protective services unless the individual does not meet the criteria of being a disabled adult who is abused, neglected, or exploited and in need of protective services. True. North Carolina General Statute 108A, 101, and Manual 3-3. Question number 7. The adult may be unwilling to participate in the evaluation or may not allow the APS social worker access to the house. The APS social worker should use good social work skills and, if necessary, court order to gain access to the disabled adult and initiate the evaluation. True, and it can be found in North Carolina General Statute 108A, 101, Manual 3-3. Number 8. The worker receiving a report must explain notification and evaluation procedures to the reporter. True. State Policy, Manual 3-2. Number 9. When a report is received alleging abuse, neglect, or exploitation by a Social Services Board member, DSS staff member, or county commissioner, the DSS handles the report like any other and screens it accordingly. False. State Policy, Manual 3-2. Staff shall call their APR for the report to be assigned to another county. Number 10. The intake worker is required to use the intake form and ask the questions in order. False. It can be found in Manual 3-8. Workers should use the form as a tool, not a crutch. Should not read the questions. Listen to the reporter and fill in as the conversation progresses. We will now discuss the history of APS. North Carolina had the first elder abuse law in 1973. Then in 1975, the first APS laws followed. The funding source to APS is primarily SSBG. SSBG stands for Social Services Block Grant. SSBG is a flexible source of funds that states use to support a wide variety of social services activities. APS laws vary from state to state. North Carolina had the first elder abuse law in 1973, and there is no federal law regarding the protection of older and or disabled adults. APS services are mandated in the state of North Carolina. State mandated means any state constitutional legislation or executive law or order which requires any local government to establish, expand, or modify its activities, programs, or structure in such a way as to affect expenditures from local venues. Anyone in North Carolina who suspect a disabled adult being abused, neglected, or exploited is mandated to make an APS report. We will discuss the definitions of the various types of maltreatment later on. The focus of North Carolina law is on disabled adults over the age of 18. North Carolina law does not focus on age but rather on disability as long as the adult is over the age of 18. In North Carolina, Department of Social Services evaluate the need for adult protective services. Adult protective services in North Carolina law can be found in North Carolina General Statute 108A. In North Carolina General Statute 108A, you will see that the Department of Social Services has a responsibility to receive, screen, and evaluate reports of a need for protective services in domestic and institutional settings. DSS is the only entity statutorily that is authorized to provide protective services. No one else can. Data gives us a picture of factors that increase the likelihood of becoming a victim of adult maltreatment. Women tend to outlive men, and this could account for the higher rates of maltreatment for women. If a physical or mental vulnerability is present, this creates added vulnerability that a perpetrator may prey on, as does the dependency on someone else to meet your needs. If someone has suffered a loss, such as a death of a spouse, or they have little or no natural supports, or people checking on them, they are more likely to be maltreated. Data gives us a picture of factors that increase the likelihood of becoming a perpetrator of adult maltreatment. Current national research suggests that 60% of abusers are family members, with the majority being an adult child followed by the spouse. There's also a surge of grandchildren abusing and exploiting their grandparents, as we have a high population of grandchildren living with their grandparents. There are many causes or motives of abuse or neglect. Financial gain could be someone's that's caring for the adult and gains the adult's trust and then feels that they are entitled to the adult's money. Unaddressed mental health issues could be a contributing factor by way of either the caregiver or the adult having mental health concerns that are unaddressed. In addition to the caregiver having their own potential mental health concerns, the caregiver may be tired and overwhelmed from performing caretaking duties. Sometimes perpetrators are motivated by the need to have power and control over another individual. Let's look at the definition in North Carolina for disabled adult. The adult has to be 18 years of age or over. The adult must be present in North Carolina, and the adult must be incapacitated by a physical or mental condition. The key word as it relates to disability is incapacitated. Incapacity is defined as the inability to do something. This references a functional impact. Disability is not hinged on a diagnosis in the state of North Carolina. Rather, the essential question is how the adult's impairment affects the adult's ability to function day to day. You should gather enough information to determine what the adult can and cannot do for themselves. Sometimes a reporter will focus in on the adult's age. Remember that in North Carolina, the only age consideration is that the adult must be over 18. Functional limitations must be explored to determine if the adult is disabled according to the North Carolina APS definition. An example of this could be that an adult had a stroke last year and now requires help with bathing and cooking. Another example could be that an adult has some memory loss and is confused a lot and affects their ability to manage their needs. Let's take a closer look at disability. Each of these factors may or may not impact an adult to the point of a disability. There are many types of physical and mental impairments. These include, but are not limited to, chronic disease like diabetes or COPD, mental illness such as depression or schizophrenia, cognitive impairments such as dementia, developmental disabilities such as Down syndrome, or results of an accident such as traumatic brain injury. As you can see, just based on this very small list, these impairments could have a huge impact on functionality or could be managed with medications or other interventions such that the impact of functionality is reduced or even eliminated. Diabetes is an excellent example of a condition that can run the spectrum of well controlled with no functional impacts and life-threatening. This is why it is imperative to explore at intake how the disabling condition are observed and how it is impacting the adult's functionality. Remember that disability should be interpreted broadly. If it is not clear that the adult is not disabled, the screener should err on the side of caution when answering questions to determine if the adult is alleged to be disabled or not. There are a number of factors that affect disability independence. Coping ability refers to someone's ability to cope or understanding the needs they have. The adult also may have financial resources to assist with caregiving or daytime activities. They may have a positive attitude about their disability. If the adult has been disabled for a long length of time, the adult may have adapted such that the functional impacts are reduced or lessened. The adult may have a strong cultural values or beliefs that offer support. In addition, the adult could have made environmental alterations such as adding a ramp to the house or moving furniture such that there is always a point of contact. These adaptations could eliminate the concern for maltreatment or the need of protective services, or they could be strengths that are captured in evaluation. Caretaker can be defined as an individual who has taken the responsibility for the disabled adult's day-to-day well-being. This can be done voluntarily or by contract. Examples of caretakers can be a family member or a friend or a neighbor or any other individual who has decided to have the responsibility for ensuring all the adults' needs are met. Some examples that are not considered to be caretaker are neighboring checking on the adult 2 times a day, Meals on Wheels worker whose only role is bringing food, and an in-home aide providing care every 2 hours. These are not caretakers as they do not assume responsibility for the totality of day-to-day care. Abuse can be defined as willful infliction of pain, injury, mental anguish, or willful deprivation of need services or unreasonable confinement. In order for an APS report to be conducted for APS, the APS must be perpetrated by a caretaker as described above. If the caretaker definition is not met, or if there is not willful intent, DSS must consider if the report meets criteria for another type of mistreatment. Abuse must be both willful and perpetrated by a caretaker. Any act of infliction of pain, injury, mental anguish, or deprivation by a caretaker that is not willful could be considered for caretaker neglect. Consider the following scenario. An adult is in need of life-sustaining medication. The caretaker leaves the home for the day after willful refusing to provide the medications. Upon leaving the home, the caretaker is heard saying he is not getting the medications because he does not care if the adult lives or dies. This would be a concern for abuse as there is willful deprivation of a needed intervention. Locking an adult in a padlocked room with no exit capability would be considered unreasonable confinement. Some signs or indicators of abuse are injuries, bruises, fractures, or even burns. Clues could include suspicious behaviors such as elders and their caregivers offering differing explanations for the injuries. Since finances could be a motive for abuse, care should be also taken into consideration suspicious documents such as recent executors of wills, deeds, or trusts executed by disabled adults with severe impairments. Abused adults may be isolated from activities or social circles that they previously actively participated in. Neglect can be defined as a disabled adult who is without and is not able to provide for herself the services necessary to maintain mental and physical health, or who is not receiving the services from his or her caretaker. These are 2 types of neglect: self-neglect and caretaker neglect. Self-neglect refers to the inability to provide necessary services to maintain or help address physical or mental health and well-being. An example of self-neglect would be that the adult not giving himself medication. Caretaker neglect is not receiving services from the caretaker to maintain physical and mental health. An example of caretaker neglect would be that the caretaker is not giving the adult medications. Neglect does not automatically occur if the adult fails to take medication or prescribe one time or skips a medical appointment. The key factor is assessing if the failure to maintain physical and mental health, such as in our scenario, a medication noncompliance, is causing adverse reaction or decline. Exploitation is defined as illegal or improper use of a disabled adult or their resources for another's profit or advantage. Financial exploitation is one type of exploitation. Examples of other types of exploitation include exploitation of a person or of a person's assets. Some examples of financial exploitation could be bank fraud, cashing checks without the adult's consent, and using the adult's credit card. Exploitation does not have to be by a caretaker to fall under the APS statute. A common allegation of exploitation occurs when a facility alleges that a family member, friend, or otherwise responsible individual is mishandling the resident's finances and the resident's bill has not been paid. A critical issue to consider in this scenario is what is alleged to be happening with the funds. If the funds are being used for the person's personal gain as opposed to meet the health, welfare, and safety need of the adult, this would be a concern for exploitation. The focus of APS is on stopping the exploitation, preventing further exploitation, not collecting the past due bill. Consider another scenario. An adult resides in a facility. They have no guardian. The adult is in need of a surgical procedure. The medical professions will not accept authorization from the adult due to capacity concerns, and there is no other parties willing, able, and responsible. This would be considered neglect. For APS purposes, the focus of the evaluation is on the specific resident rather than on general conditions of the facility. Referrals can and should be made as needed to the appropriate licensing entity if there are overall concerns that are not specified to an individual. If an adult is in need of protective services, this means they are unable to perform or obtain essential services and that they are without able, reasonable, and willing persons to obtain essential services. If someone has stepped in to provide protection by the time the agency receives a referral, then the adult may not need services. The person performing or who has obtained the essential services for the adult must be able, responsible, and willing. Sometimes an adult has a person who is willing to help but is not able because of lack of money, poor health, legal status, etc. If a disabled adult continues to have essential need gaps, this would indicate the adult must be in need of protective services. Remember, it is important to separate and consider separately whether or not the reasonable party is able, responsible, and willing, as each of these has its own considerations. As a reminder, any person having reasonable cause to believe a disabled adult is in need of protective services shall report such information. This is a North Carolina General Statute 108A. North Carolina is a mandated state. Protection is a shared community responsibility, so much so that the need of this partnership is described in General Statute 108-103B. It is essential that the community and local agencies work together to improve the lives of disabled adults who have been abused, neglected, or exploited. Listed here are various community partners you may work with. The list includes mental health providers, health departments, hospitals, adult daycares, home health agencies, law enforcement, churches, and multidisciplinary teams. However, this list is not all-inclusive. One of the forms you will use quite often in your work is the DSS 5027. In short, the DSS 5027 is designed to be used to update each time services are requested or terminated, when income eligibility is determined or redetermined, and where services policy requires notification to the client when the services are reduced. Everyone should have printed off a copy of the 5027 from a website. Please pull it out now and look at it. It is important that you fill the 5027 out correctly, and all areas need to be filled out. I will go over the 5027 in more detail in subsequent basic skill webinars. However, at this time, I want to ensure you are familiar with this document. The DSS 5027 is the application for service and the means to transmit authorization to service providers to claim reimbursement for service provided. The SIS code for intake is 200, and this does not go on the 5027. The APS code for 202 is for evaluation, and the APS code 204 is for planning and mobilization, and these codes do go on the 5027. Displayed, you will see a copy of the DSS 5027. It is highly recommended for any social worker who completes a 5027 to watch the webinar that more thoroughly reviews the forms and describes how to complete it. This webinar is found on the DAS website. This concludes this webinar. I want to thank everyone who participated today, and I hope you found it helpful. If you have any questions, you can email the listserv at daas.adultservices@dhhs.nc.gov.